Okay, I think we are live. Hopefully we are. Whew, okay. Salutations and greetings to all of my global community out there. So, my name is Alicia Moore. I am a neuromuscular massage therapist and I'm licensed here in California. And I am also, in combination with that, a global partner with a company called LifeWave. I will start to introduce LifeWave a little bit towards the end, but I wanted to start, really opening up this conversation around pain. I deal with so many people that come in, and they have been dealing with this pain for X amount of years. Now, when it gets into years, like as we'll see in my little kind of presentation here today, that anything over 6 months is considered chronic. Okay, and unfortunately, the current methods of pain management are failing a lot of people, and so I want to start to get more into my community at large, so to say, because I feel like it's has become a problem. People going to the internet. Yes, the internet and Google have really good answers and they can explain a lot, because we've taught it all of these things. And the reality of it, though, is, have you actually been diagnosed with sciatica? There is actual like tests and things that that your doctor will do. A lot of times it's going to involve MRIs and um, things of that nature to see what's going on internally. And from that, they're able to determine, if you actually have sciatica. Now, it's funny because sciatica is actually kind of originating at the low back but when it starts to get severe, it really does start to travel down the leg, and that's because it's for one, it's a huge nerve, okay? And as it's traveling through the leg, it does begin to branch off, and they've named, like, as it travels down the leg, they've named it, different things as it's going down, as it's kind of pertaining to different areas. But still, the matter of the fact is, it's going to more than likely originate kind of up in the back, kind of the low back there. Now, when it starts to travel into the hips, though, we're looking at more of the hip rotators of the body in the hip, and what is causing compression, and or it could be damaged down in the hip, or it could be damaged in the back, resulting in that uh, discomfort and pain, and just like not able to function really. And so I'm going to be going live every day. So this is day one. I have a live webinar coming up towards the end of the month on the 25th of August. That's going to be the first one. And then after that, I'm going to be kind of doing them each month, as I help to really open up this conversation around pain, because there's many layers that come into factor when we are talking about pain. And I have realized that a lot of times pain is kind of looked at as like very superficial, and the reality is it could be coming from an organ. it could be coming actually from inside of your body, and you're really only noticing it like in your shoulder, or you're only noticing it in your knee, but the real root cause is actually within. So let's get started. So I want to start off just talking about pain. Gradually, we're going to start talking, like over these days that I'm doing these lives, we're going to start talking about sciatic pain. In the webinar, I'm going to be doing like a real deep dive of anatomy and what's actually going on in the hip. I will be touching on things like nutrition and hydration. And then I'm also going to kind of debut something that I feel is worth promoting or sharing and helping others, because it has helped me. I've been testing it out. I don't like endorsing things that give placebo effects. I don't like endorsing things that might work for some people, and then it's not going to work for another part of the population. I always want to find things that actually are working, and that is something that is, you know, working with our body naturally. Okay, many of you know I do a lot of things when it comes to energy work. I'm a massage therapist, I'm a body worker, and so naturally I'm working with other people's energies, essentially. Energy that's either stuck in their body, that's not flowing, things of that nature. Okay, and with pain, there are different types. Okay, so the first type of pain is called acute pain, spelled ACUTE, pain. The definition around this is that it's short term. Okay, it's a short term pain. It's something that suddenly happened, something like slamming your finger in the door, or bumping your toe or your knee at night when you're like going to the bathroom and you're like, you got that pain, but it's gonna go away. Like, you're not gonna feel it, 3 days from now, right? It's gonna be gone as far as the pain. It may be a little sore, right? Especially depending on how hard you hit it, or man, if you slam the finger in the door, that could, hopefully, didn't break, but slamming or catching, a little bit of something, that pain, that instant pain, that's something that's acute. So it's sudden, it's right now type of pain, not something that you've been living with. And some examples can be surgical pain, fractures. Although fractures, I don't know, 6 months. Yeah, if it's going on longer than 6 months, then you're something within side is not healing properly. But a fracture or a broken bone, that is still considered acute, because after the trauma happens, the body immediately starts to go into heal. And also burns or cuts. I don't know if you've noticed, but like, I don't know, for me, there is a little bit of a delay in the pain. Like, I'll feel the initial, because I recently, what was I doing? I like to burn incense, and so I don't know what I was doing, but I was like moving it, and somehow it, the lip part like touched the tip of my finger, and I was like, man. And it didn't really, I mean, I felt it, but it didn't hurt like immediately. It took a little bit of time for my body to realize that something had happened there. And then like my finger kind of throbbed for a little bit, maybe for like an hour or so. I was like putting, trying to do ice, and cold on it, just to help so I wouldn't get a blister or anything. But funny enough, because I've been wearing the wearable technology that I'll be sharing towards the end, after that, like nothing. And then I didn't get a blister or anything like that. So the next type of pain is chronic pain. So chronic pain, everyone I feel is familiar with chronic pain because so many of you are dealing with it, living with it, trying to ignore it, trying to settle it down with your, you know, prescription medications and over the counter medications. Now, when a person gets to the point where they're having to use both prescription and over the counter medications, it does concern me. I'm not going to lie. Um, I immediately think about the liver because the liver is our biggest filter. If you didn't know that, along with the kidneys are also a major filter for us. And if you're taking so many medications, like it's going to impact the function of the liver. And it can also impact the amount that you have to take over time because as your body is taking, you're feeding it, you know, you're consuming these medications, um, your body will start to like adjust and get used to that. And so that's why your doctor's like having to prescribe higher and higher dosages, which in turn, you know, can have not the best effect. And so, you know, or they may switch you to a whole new prescription, you know, but then again, it starts that cycle over. Like the body's going to eventually get used to it. And so I had to really start asking myself as a therapist, you know, people are coming to me, they're coming to me with their pain complaints. You know, they've gone to their doctor, but their doctor may not really be, um, I can't speak for the doctors actually. You know, I don't know what their reasonings are, but they just may not have the resources to actually help this person in a deeper level besides, you know, looking at. Okay, so I think I'm back. It's so interesting because I just upgraded my internet, but I swear it's like still buffering so much. But anyway, back to what I was talking about with the chronic pain. Chronic pain is going to typically be long term. Um, I always say any anywhere if it's longer than 3 months to 6 months, that's when it's starting to creep into the chronic pain side of things. Because I've noticed that okay, a person will have an injury, they'll have the you know onset acute injury, and then you know their doctor or primary care is starting to you know prescribe physical therapy, chiropractic, maybe massage. There's still this really weird stigma around massage, and doctors are not always like so forward in recommending recommending massage, especially medical massage, which is more the style. I do more clinical medical massage. Hence the you know the depth of getting into the pain. Okay, so anyhow, when make sure just making sure I'm still on, guys, because it's been kicking me off. So yeah, so chronic pain, if it's more than 6 months, it's considered chronic, and it can last for years. I've met people who have had pains for like over 20 years, and you know I work with them a bit, get them some education around what's actually going on, and then we really start to decrease that pain. They're able to start going longer. Now depending on the length of pain that, or length of time that a person has been in pain, you know, it used to take a few sessions to start to really re-educate the body, because the muscles have memory. So if the muscles memory is to always be short and tight, they're gonna try and go back there. The goal with massage and with trigger point therapy, neuromuscular therapy, is to help re-educate the musculature and the body uh, in that area that we're working on, to help to re-educate it, that it can lengthen. It doesn't have to stay short and contracted, because when it stays short and contracted, that creates weakness in the muscle, it creates pain, and then it just creates just this whole thing of a discomfort, and the person seeking and going after all of these things. Okay. And an example of chronic pain is something like arthritis, okay, back pain, migraines, and fibromyalgia. These are all conditions that, again, when we look at the liver, we will see. I may talk about it. I have a book here that I highly recommend, and I'm not gonna make this video focused on that book, but it has helped tremendously. That's what I first started with getting my pain under control, because I was not one who took any injections. I rejected those. Um, Mainly because they were trying to experiment with me, with a experiment on me with some new injection that was supposed to, be better than cortisone. And I was like, okay, well, can I get the information sheet on that? Because you do have the power to ask for the information sheet on whatever medication, injection, or whatever is being offered to you. So, with these conditions that I just listed, especially like arthritis and fibromyalgia, I encourage you guys to get your blood work done and see, do you have elevated enzymes from your liver. That is an indication that you may want to consider doing a liver detox or flush. Um, and this book actually has instructions on how to do a liver flush at home. And so the next type of pain is nociceptive pain. And this type of pain results in damaged tissue, and also inflammation. So when a person is really inflamed, a lot of times there's going to be a pain associated with associated there. It's going to be sometimes it's going to be heat that is in the area, and also just a lot. It can be a lot of pain. An example of this is arthritis, still, after surgery pain, and sports injuries. And so, sprained ankles, sprained wrists, um, the arthritis in the knees, in the hips, in the shoulders, in the hands. Um, those are typically a result of inflammation. Your body is not clearing out the inflammation fast enough. And the prescription medications are really only turning off the signal to the brain that there's a problem in that area. And so moving on to the next type of pain, which is neuropathic pain. And that's the pain that I typically deal with the most. with my patients and clients. And this type of pain is where there's a miscommunication between the brain and whatever body part or area. Um, it would be things like diabetic neuropathy, sciatica, and excuse me, phantom limb pain. So the type of pain that we'll be honing in on after today is going to be neuropathic pain, but the other types of pain also fall into the category of what the wearable technology can help with. Okay, and the last one is psychogenetic pain. And psychogenetic pain is not really talked about as much, but it is pain that is related to psychological factors rather than physical causes. Okay, and so this is where it's more like your emotions or mental stress. Like emotions and mental stress can cause physical pain. And things like depression and anxiety. There are actual physical kind of reactions that happen when those things arise within a person or in a person's life. And being able to recognize these types of pains, like what type of pain would you say that you experience the most? Is it something that has been acute? Is it chronic? Is it nociceptive? Is it neuropathic? And or is it psychogenetic? And sometimes, I would say often, not sometimes, but oftentimes I find that there's a combination of these types of pains kind of stacked with each other. So mechanisms of pain, there are 4 mechanisms of pain. Okay, there's transduction, transmission, perception, and modulation. So transduction is the process of conversion of noxious stimulus. So heat. So that's why I was saying in the beginning that, you know, something could be going on with your spleen, something could be going on with your stomach, something could be going on with your large intestine, something could be going on with your small intestine, something could be going on with your kidneys, something could be going on with your liver. Now, if anything is going on with any of these things, your body, one of the ways that it's communicating with you is to let you know that there is pain. Now, you might feel it at the actual site of the organ. I mean, obviously, some of them are deeper within, but you know, if you are having like these weird pains or cramps or things of that nature, it could very well be that organ trying to communicate with you that something is going on. And then there is transmission, and this is the process of sending the electrical signal from the site of pain or injury or wherever it's hurting to the spinal cord and the brain. Now, when you're having pain such as sciatica pain, a lot of times the brain may not even be getting the signal, especially if you're doing things like cortisone shots and prescription medication and over-the-counter medication, because the goal of those things are to like help dim it down, right? Or to even completely cut off the message that that body part is sending. So for example, you're having a pain in the hip, right? You're doing all the stretches, you're taking the medicine, but yet it still comes back. Now you go to the doctor, you get a physical, you're telling them, you're like, man, this pain is starting to affect my sleep. I it's starting to affect my work. And I notice it affects people whether you have a standing job or a sitting job. I know there's kind of this common thing of like, oh, if you have a sitting job, you know, you're more than likely. And I'm like, no, I've worked with people who stand on their feet all day. Like I said, nurses. I worked with nurses. I worked with general customer service